Hello and welcome back to Staying Up. Today we are giving you an update on what is truly has been the most stressful few days of our entire lives.
Lots has happened since we've seen you last.
And the first few days of IVF. So yeah.
Let's get to it. Hello and welcome to Staying Up with Cami and Taryn. I'm Cami.
And I'm Taryn. And every night me and my wife get to have a sleepover, but every week we invite you to join us. Thank you for staying up.
Thanks for staying up.
Thanks for staying
Normally you're the one yawning and I'm already yawning. It's been a doozy.
It's been a fucking...
If you're watching, I feel like we say this every time. We're always in a new setting. Where are we going to be? Normally we're just like beat bopping around our house. Yeah. But we're in Newport Beach, California. It's beautiful. This place is gorgeous. I'll make sure I do a tour on like TikTok or something when we're leaving. I don't want to like tour now and then like show people street signs. That sounds creepy, right?
I mean, people that want to find out where we are can do it very easily.
Yeah, but you never want to give people.
You don't want to give them the bait.
You don't want to give them the ammo.
You ain't gonna give them that.
So why are we here, honey?
We are in Newport Beach because our doctor, our fertility doctor, is here. He is super highly regarded and. We're so out of it, guys.
This is so bad. I'm not even doing the shot yet and I have brain fog.
Our doctor is like has a super good reputation for being amazing at IVF, I guess. I don't know. And so we were like, well, we'll just come down here because we have to go to doctor's appointments all the live long day.
Yeah, it's like every other day at first and then it becomes every day. So.
Yes, for monitoring, which we'll tell you all about so soon.
Yeah. So a quick recap, because I've been getting this question a lot. I think the PPs know, but for IVF, we are both doing egg retrieval. Taryn's going right now. I'm going to go as soon as my period starts, which is next Monday. And then I will carry our first kid. I will carry both kids, but our first kid will be the embryos using Taryn's eggs. So that's why we're both doing egg retrieval. People keep commenting on our little like shot daily vlogs being like, wait, I thought you were getting pregnant. Why is Taryn doing this? So a little update there.
She's about to get stuffed up like with me eggs like a little ravioli.
That just made me think about how Molly May and Tommy Fury broke up,
bruh,
and that he clearly cheated on her. But we won't.
One
get
of our
into
favorite
that.
couples. From, oh my God, stop! One of my favorite couples from Love Island broke up. The world's favorite couple, truly. But today we're going to talk about just how kooky of a last week we've had.
Yeah, mainly we're going to focus on IVF. It has been very daunting to learn information, so we want to share as much information as we possibly can.
Yep.
But we do need to fill you guys in very quickly, because we have decided we're done bitching and moaning.
And I mean this, what I'm about to say, wholeheartedly. No hyperbole. I mean this to my fucking core.
Oh, no, what?
Saturday and Sunday were the single-handedly most stressful days I think both of us have ever experienced.
Yeah.
Truly. I've never felt so much continuous stress and like doom gloom.
I gave a full timeline from Thursday morning until Sunday evening or Monday morning on my last YouTube vlog, which, by the way, I'm back on YouTube.
This bitch is back. Just when you thought she was fucking done, here she is. She. Zoom, zoom, click,
I
click.
was done. It's been like years, but I posted a vlog, and I plan to be doing them hopefully weekly, at least throughout this journey. So
I loved it.
Subscribe.
I love when you vlog. Yeah.
Thanks, honey.
I really do. I feel like it's fun to just see your little life, even though I live it with you.
Our life.
It's just like the way you do your little, like when you talk to the cameras too. It's like, I don't see that.
Yeah.
I'm like listening too.
That's really cute.
And it's cool to see. Someone commented on the vlog and was like, their kids are going to get to watch all of this someday. I'm like,
I saw that.
Sick.
It's really cute to be able to have them see like our relationship progress, us buy a house, get married, go through the process of having them, and them get to see the ups and downs of that.
Hopefully they'll want to pay us back for everything we've done.
Yeah, they'll be like, damn, this was tough, mamas. But yeah, I have been recording stuff for YouTube, and I've even edited vlogs, and I don't know what it is, but I just haven't been posting them. I just keep getting weird about it. So
I'm taking a picture of you. You look so cutie.
Why are you taking a picture of me?
That's very cute.
You're cute. But yeah, I'm back for the foreseeable future.
But she was saying that because she has kind of timed out what has happened the last couple days on there.
Give like
if you
a
want a full
5-minute
rundown.
timeline, deep dive into the days we started fertility. Riggy got an injury, so I detailed that, and then like how that made the chaos ensue.
Yeah.
Ow.
What'd you do?
I don't know. I
Smacked your
my
hand on
down
something?
and it, like stabbed me.
Oh God! Now you're gonna get an infection. I don't have time. I really don't have time for all this.
No, we don't have time for this. Taryn started her. Do we want to give any kind of detail on the chaos? No, we want to move on from the chaos.
Just
right?
give like a literal 30-second madness.
Okay, Taryn started her shots Friday evening at home. We had to drive all the way down to Newport and back that day, knowing we were moving here on Sunday, so we were just stoked. Saturday morning, took the dogs on a walk, noticed that Riggy's leg was starting to swell up. In a matter of about 10 to 20 minutes, it's got very, very swollen.
Her little
we had to
chunky
take her,
ankle.
Oh my God, I will never forget that fat little leg. We had to take her to 3 different locations to get to the right place to handle it. They thought it was snake bite. Wasn't a snake bite.
She had a fever.
She had a fever. She was acting all weird. It was an abscess and an infection on her leg. They had to pop it like a freaking pimple. Boom! It exploded. Really disgusting. We didn't get to see it. I mean, we didn't have to see
felt it.
I wouldn't have wanted to see it. And now she has a hole in her leg. And if you have ever dealt with this with a pet, you may know that they just let it drain everywhere. You're not allowed to cover it. It is. It started the size of a quarter when they first opened it. It's now probably like 2 quarters, I would say.
It's
stretched.
definitely more of a $50, if not bigger. It's bigger
because it's
you
like
guys,
oval.
If you're watching on video, it's like this. It's like this big on her knee, like on her side of her leg.
Really sad. Her and Frank can't be around each other. He was getting weird with her because she didn't smell like herself, and he's very dog reactive. She has to have a cone on. We have to keep everything clean and safe. It's luckily now not like draining, but the first day at our house, it was
Guys, it was gushing blood. Like Cam started sobbing because at one point it like she like took the bandage off and like blood just like spewed out like a horror movie.
A horror movie if somebody got like stabbed or something and you like put a cloth on them and said apply pressure and then they let go and it just spewed out.
You had the lines.
Baby, it's been
apply pressure, Johnny.
Well, they kept saying apply pressure to her leg and I was like, we are.
Yeah, we could not be applying more pressure and there's so much pressure all around us.
But she's doing much better.
Yes.
And so are we.
And we had to drive down to Newport in 2 separate cars. We're just bitching. We had to drive down to Newport in 2 separate cars.
We're not in bitching mode.
Funny mode. And then whatever, we got here and then my parents were so nice to come and like drop off a dog bed and some of Frankie's blankies and
I don't even know where those blankets were from.
We should start a company.
That's cute. We should start a company because he's literally always sucking on his blankies. He is right now. I can see him. I will take a photo so I can put it on the
Staying Up Insty.
On the Staying Up Insty. There he is. So cutie.
But my parents got here and they're like, wow, you guys, this is so beautiful. Are you so excited? And
no.
I looked my dad in the eyes. I said, I'm not okay, Dad. I've never been more stressed than I am at this moment. I am not okay.
They were being so sweet, trying to like be so positive and like switch our mind frame.
Yeah.
But I think we needed a minute to be like, that was so intense. It was like, and we like hadn't slept because we had Riggy. We took her in Saturday and then we had to take her back a couple times. It was a whole thing. And then we took her back in first thing in the morning at like 6 a.m. So we just didn't really sleep because we were so worried about her and had to get up early and had to pack and drive.
And I'm doing my shots for the first time. And so that anxiety is kuka fucking munga.
But we've been dying because we're like, that has been the easiest, least eventful part of our day every day. Honestly, it's been my favorite part of the day.
Same.
I wouldn't say the same if I was getting shots.
No, it has been fun. And we've been making it progressively more fun.
Yeah, we turn on music.
Yeah.
We vibe out. And I think now that you're not as stressed about like side effects and doing it, you're like having more fun with it too.
Same.
Last night's was very fun. We had like a DJ set playing and we were just...
If we could drink, it'd be even vibier.
Well, we can. Do you want to talk about your... As you guys know, we have been trying to cut alcohol out. We have cut alcohol out.
We haven't had alcohol in like a month.
Crazy. Do you want to explain your first appointment at IVF?
Yeah, so we're just going to break down everything that has happened so far in IVF in our little journey, because when I knew that I was going to start my shots and everything, I like frantically started listening to podcasts, watching YouTube videos, like trying to get everything I could. And a lot of you guys sent recs, which was awesome.
Yeah. Just nice to hear it from like a person's actual perspective, because these doctors are great, but they work with so many people that they're not like holding your hand through this process.
And a lot of times people make content when something really bad happens. They're like, let me tell you my crazy IVF story.
Oh, that's a good. So that's probably freaking you out. You were seeing.
And it's not like just like the average person that goes through this experience is not like really documenting
my
it.
goal, knock on wood, is that we get to share like the best side. I hope the most stressful part of this IVF journey was
Brigand.
that we had to like move here and Riggy and the chaos of that.
Yeah.
And that we're like, that was a good omen because we got all the bad out of the way first.
Yeah.
And I hope we have like a really successful, amazing, smooth sailing journey to share with y'all.
So before the appointment, we're just going to get into it. Before the appointment, your doctor orders you all the medication that they think you're going to need. This box.
No, you have to order, and we almost didn't order because
Yes.
we didn't know. And I called them, and I was like, it says weeks ago. And they're like, oh, yeah, oh. And then it got there in a day, so it was fine.
I was there in a day. But Cammie wasn't home, and I had a really stressful day, and I opened the box, and I was just like
about that day.
sobbing. Yeah, that day was bad too. And I was sobbing because this box had the spookiest of needles. It's
just so many.
So many papers, you guys, like an 8th grader's backpack.
Well, I'm
Just,
mad
like,
that I didn't know it was
fucking
coming in
reams of
this
paper.
because there was like a stack of papers that was just what each medication is for, kind of like what you hear at the end of a infomercial for a new prescription
When you get your antidepressant and
Yeah,
they staple the
that
paper
long-
onto your bill.
that nobody reads.
Yeah.
But it was like all of the side effects, and I was praying you just didn't read through it because I knew that would stress you out. So I was like, oh my God, this is not what she's supposed to be looking at. Why did they warn me?
And we all know Miss Me has incredible health anxiety. And
incredible. I like reframing it to incredible instead of terrible, awful.
Sure, incredible.
Like, it is incredible.
It's incredible
but
what
incredible
it can
sounds kind of more positive.
I'm in the Incredibles, and my superpower is my health anxiety. And I was really coming into this really working hard on not learning about the side effects of medications because I will talk myself into any fucking side effect. If it's like you're gonna see everything in a hue of blue, I'll be like, everything's blue.
Now
like
that you mention it.
Yeah. Honestly, it's giving blue right now.
It is giving blue right
Honestly, that was weird.
But I'm not on the shot, so it's good.
Whatever.
But it is giving blue.
Now I'm scared.
Because we're right next to the ocean.
At the beach.
The ocean's right
and
there.
like the sky too.
It's all
But
we're losing it, y'all.
So I get this box, and it's like a very spooky box to open. I highly recommend not opening it if you're doing IVF alone. Sorry.
Yeah.
I highly recommend not opening it alone if you're doing IVF.
Yes.
Open it with a friend, open it with your spouse, open it with a partner, because it's just
but you had
needles.
To because some of it needed refrigerated, and they scare you of like immediately get those in the fridge.
And there's like so many injectables in little bottles and like things that honestly are like, to me, very like drug associated. Like I'm like, that's like people just like mixing shit up and shooting it up. So
yeah, you're like, see,
dude, and some of these needles, you guys, were
I would say 4 inches,
3 to 4 inches long. Like I'm like, where is my body even thick enough? Not saying I'm so fucking skinny, but I'm saying like it's gonna hit my bone.
I'm gonna hit an organ.
I'm gonna hit something. If I put that on my leg, it's poking out the other side. So anyway, I get this box of medication, and then my period starts, and you're supposed to call on your first day of period. I call. They say that they will book you an appointment 1 to 3 days later, but like 3 days is how they had been talking about it.
3 days is what I saw online everywhere. It was like you call, and then 3 days later you go in. If it falls on a weekend, it'll be like the 4th day, and that's okay.
And so I'm like, hey, I started my period, and they're like, okay, are you free to come in tomorrow? I'm like, you bet your bottom dollar I am.
And I was like, are you sure you want to drive down there at 6 a.m.?
And
you're
I
like,
said, yes. Because I just want to get this over with.
No,
it's
so
the
fair.
waiting that is just like a lot.
And I want less crossover between us.
Same.
So.
Because the emotions, you guys, have been out of the fucking world.
Yeah. So, if we can not have so much overlap, that'd be gorge.
First appointment, easy peasy. You go in, they give you the transvaginal ulti, which is a transvaginal ultrasound that is like it's a big skinny probe that I would say is about 12 inches long. Like it's like a foot.
Like shockingly
it's
long.
huge.
But you said not painful.
No, it just feels like they're mushing you around a little. Like
I hate this.
And and it's like a baby monitor kind of thing.
Yeah,
and you
we
can
get to
see
look at
all your follicles. And
they like counted them with us.
They count them and they tell you how many there are. Cam said she had a different count than the doctor.
And then we talked to somebody and they were like, sometimes they get those numbers wrong because you can't really see everything. So I might have been right.
You might have been right.
But she has a very perfect amount of follicles to start with.
So far,
so we are very happy about that. She has 10 on her left. He saw 6 on the right.
But he said the rest he thinks are hiding behind
your ovary was kind of blocking it.
Yes.
Or your uterus, was blocking it.
No,
your uterus.
What is what? It's incredible how much I don't know about my body through this process.
It's incredible how, especially in America, we, even having these body parts, don't really learn about them growing up.
How do you use them?
Well, that we learned with practice. We learned that one with practice.
But
that went great. We were really happy with that amount. So that was really cool.
And then, like, our doctor is amazing, but, like, does not give you any information unless you ask it because they see people every 15 minutes. So he
doesn't see us the whole 15 minutes. Like, she got back there.
He sees us for 2 minutes.
Got undressed. He comes in. He does the ultrasound.
He probes me.
He probes her. And then he's out of there. And then she goes in for her blood test. So the whole thing is 15 minutes. He's in there with you for maybe 2-3 minutes.
Oh, my God. And you guys, I don't know if anyone warns you about this, but the closer that you go into the start of your first day of your period, the more you're just, like, free bleeding and like on your period, and
I'm like, I don't want to do that.
I know. So then they're like, okay, before we do the transvaginal, you need to go pee and you need to take out your tampon. And I'm like, okay, what am I gonna waddle back to your room so you can I can make a mess back there?
I know.
I did.
I am very appreciative that you're going first because I just like information. Even when I'm going to a new place, I'm like, I'm the bitch who's looking up the parking. I'm like, where am I parking?
I think that's a very little known fact about you and a surprising fact about you.
Why?
Cam wants to know the exact parking situation of anywhere new she goes.
Because I hate being late, but I also don't want to be too early.
Yeah.
So, and I'm down to like park and sit in my car and wait, but I don't want to, I need to know how much time I need to allot for parking. If it's valet, and then I have to get out of my car, and I was planning on like touching up my makeup in the car or sitting on my phone because I'm 20 minutes early everywhere. I want to be able to do that.
It's so funny.
So I just like to be prepared.
And then she tells other people. She learns about the parking and then will be like, by the way, there's parking out front. Or
because I've met people who are also anxious about it or who are just like, oh my God, parking here is crazy. And I'm like, by the way, it's in the back. You might not know that.
I just find it surprising. For some reason, I find that surprising.
I don't mind it about myself.
Riggy's gash is staring me in the eye every time I look
I'm trying to ignore it, guys. I have refrained from posting it online anywhere because I think it'll just get taken down because it is so vulgar. But DM me if you want to see it.
Literally, if you want to see Riggy's freaking gashoni, let us know.
It has made me, I am not good with gore. I've been cleaning this thing. I'm like, I'm ready for babies. I can do this.
You guys.
I licked it.
And then after the transvaginal, they give you a blood test, and then they show you how to administer the first shot.
You have to do a blood test every time you go in.
I love that aspect, but I understand that.
Can't they
basically
just, like, sniff me?
They're like, our estrogen dog is going to come in and give you a sniff.
Amazing.
That would be
I would love that. I'd be like,
amazing.
come here, baby. Sniff me, armpit, face. Where do you need? They probably sniff right up in your crotch like Frank does to everybody.
The blood test that they do is to make sure that like your hormone levels, to see where your hormone levels are.
Yeah.
And then to tell you how much medicine and what medicine they're going to start with.
Yeah. Get your baseline.
So then like 2 hours after I did my blood test, the doctor called. He's like, hey, Darren, this is Dr. Anderson. Just letting you know, you are going to do Riggins just went flying.
Yeah.
You are going to do, I did 450 units of Gonal F.
Do I need to bring up my...
No, I got it.
Okay.
450 units of Gonal F, which is like an entire pen of Gonal F. Gonal F is the medicine name.
Amount.
And they show you how to do it. And during this first thing, I'm like terrified because I'm learning how to put this needle inside my stomach, which honestly is not that scary, but it's the fact that it's your tummy and you're doing it to yourself because Cam's not going to do it for me.
Not a chance. Not a chance.
The girl
I'll
goes,
support you in any other way.
the nurse goes, so you can continue working out like normal, having sex like normal, eating, drinking, alcohol, caffeine, just continue all of that like normal. And we're all like,
each other. We both looked at each other and we're like, like still, even now, I'm like, we cut that out weeks ago.
like fucking idiots, bro.
But I'm still glad that we did. Like, I
Same.
feel like we have really prioritized our health right now.
Yeah.
And I don't want to have to do this a bunch of times. And
Same.
like, we're spending so much money. Let's get it right the first time. Like, I'm not trying to go through this
Totally.
a million times.
Same.
It's just ridiculous. So we're still staying on our healthy game. So we are still not drinking, even though they said that we can. There's just so much mixed information out there because no one is just like volunteering to test to be like, hey, let me see if my IVF works or not.
Yeah.
I'm gonna drink this whole time. So there's like every doctor believes different stuff. Like every study is gonna say something else. So we are just erring on the utmost side of caution.
One thing that I've been loving about this whole experience is like, I thought I'd be really frustrated with how little time you get with the doctor leading up to everything.
Yeah.
But the reason that you get such little time with them is because you go on these monitoring appointments every 2 days leading up at the beginning of your IVF cycle. And then once you get closer to egg retrieval, they become daily. And the monitoring will always consist of an ultrasound and a blood draw. But since everyone is doing this people are always doing this, couples, straight, gay, the whole single people, like the whole thing.
Yeah.
They have appointments every 15 minutes all morning long.
Yeah.
And so the doctors are just like, hi, good to see you. Check. Let me see your... Great. Cool.
And then they have to call all of those clients or patients.
all
the whole afternoon. It's like from 6 till 10, they're seeing patients. From 10 until whenever they're assessing all the stuff, calling
patients. And it just
patients.
made me feel so much better because I'm like, it's not that they're being short or rushed out of like lack of care. It's that like they're so good at their jobs that they would know if something was off in a split second. Like it is so formulaic and it is so like
they know what they're doing.
Yeah.
And they're kind of like, if you're the type of person who can just trust the process and let the experts do it, you probably won't be that stressed about having that experience. But as both people who like to have the information, it's been a little bit hard.
Also, a really cute thing is, like I said, you're seeing all these couples. It's so cool to like walk into an appointment and some young couple comes out, some old couple comes out, some like person on their own, some, you know, it's just like
it's so
gay.
Sweet to
it's
see.
So cool to just see all these people.
Well, I haven't seen any other lesbians but us yet, so it's a bummer.
Maybe it's a lesbian and her man friend that we saw.
Yeah, maybe somebody had to come with her.
Yeah.
Okay.
But it's just like cool to know that we're all working on the same thing. And it's also quite sad because a lot of people are there for like infertility issues, which like, who knows? We don't know what our experience will be like.
We don't have any, and not putting it out there.
I'm not putting it out there. I'm just saying this might be the way some people find out that they are infertile.
No,
like, we don't know that.
I know. I'm just saying I think for a long time, Tara and I were speaking and we were being very careful when people are like, okay, so when would you do embryo transfer? And like, well, this and this and this have to work and we don't even know that we're fertile. So we have said that we are reframing it and not saying that like, well, maybe. We're not saying that now.
Yeah. And actually, we talked about this on our Patreon a little bit on one of the little recordings we do. We call our patrons or like the people that support us on Patreon our tops, and we do episodes for them called Top Secret. And we've been posting more often. We just wear these clip-on mics and like go for a walk and just talk about whatever we're experiencing.
Immediately
that day.
when we walked out of our first appointment, we were like, let's just record this on the microphones. Like if we don't share it, we don't share it, whatever. And we posted that, and that was really fun.
It's been fun. I like those. I like those.
I like them too.
Fun.
Yeah.
So anyway, patreon.com/stayingup if you would like to join us.
Join us. Do you want to talk about how your shots have been going? What's been working for you maybe? How we're feeling?
Yes.
Okay.
I got a lot of advice from people about the shots saying to ice your tummy.
Yes.
And that has been a game changer for me. Like Well, I don't know. Honestly, I didn't do anything else.
Yeah, but you're like, but it's been easier.
It's been easier.
So ice your tummy.
Ice your tummy.
We're not going to experiment not icing the tummy, I will say.
If you have a medication, what the fuck? If you have a medication that needs to be refrigerated, take it out at least 30 minutes before.
Make sure you check which ones, because some you might not be able to.
Oh, well.
But they, like, ask them, but the one, what are you on right now?
Gonal F, baby.
The Gonal F, the first day, we didn't have it out for the full 30 minutes, and you said you, like, could tell it was, like, cold.
I could feel it be cold inside.
Yeah, it's like
of
you
me.
want it to almost be closer to your body temperature. So just leave it at room temperature for 30 minutes before you do this.
Yeah.
But Buzzy, you've been loving Buzzy.
I love Buzzy. It's this little Buzzy bee.
Ours is a ladybug.
Ours is a ladybug because Buzzy was sold out. But we still call him Buzzy.
We don't call it Buzzy.
And it vibrates and it has a cold pack, and you put it on you, and like it just like makes the area feel like wacky, and then you don't even
trick
feel
your
anything.
brain.
It certainly works.
So that the nerve endings down there have been vibrating for long enough that they're like used to feeling something. It's not going from stagnant, like you're like moving all those cells in there, and then whenever you actually give yourself the injection, it's like your brain doesn't register anything happened.
And you just pinch your tummy and you put it right in. And I would say that the first needle for this one is maybe an inch. Would you say?
Yeah,
an
if
inch
that.
long?
I think they're a little less than an inch. Yeah, they're tiny.
And Cam does the prep. She like does the alcohol wipe. She gets the medicine all set
Good at
up.
following instructions.
Yes, and it's very cute. She's very serious about it, and she tries very hard and very sweet.
Yes, I do.
And then when it comes time, she stands behind me because she can't really look at it.
I stood next to you last night.
Last night you stood next to me.
I'm trying to progressively get better because I'm trying to desensitize myself.
Yeah.
And it's kind of working. I still don't want to get them, but
yeah.
I think tonight I'm going to try to watch you do it. Like,
I'd love
fully
that.
watch it.
I would love that.
Unless you need me to hold Buzzy.
I'm good.
Okay. If you have kids who are scared of shots,
Get Buzzy.
get Buzzy, because you don't just have to use them for IVF. Like, if your kid's scared of shots, you put it on the area while you're giving the injection too, and they won't notice it as much. So or anyone who has like insulin shots or whatever.
I'm 5 days in. Today's my 5th shot. Yes, I've done 4 shots.
Friday, Saturday, Sunday, Monday. Tonight's 5th. Yeah.
Yeah, tonight's my 5th shot, and I've had 2 monitoring appointments.
I didn't get to go with her to one of them because I had to watch the babies. Riggy was seeming like her leg was really hurting.
Yeah.
And that was tough not to get to be there with you. I did not like that.
It felt funny to go alone.
Yeah. It's like, I know it's not a big deal. You do fine at those. You're not scared. You're not stressed. We weren't going to hear any big news.
Yeah.
I wasn't missing anything. But this isn't like a normal doctor's appointment. It's part of making
A baby.
our kid.
Yeah. And so far, what I would say that I feel is a fairly consistent ickiness in my tummy that feels similar to a period. It's
Wait,
not.
before we get into the like how you're feeling after the injections, will you explain a little bit more for my benefit, I'm sure for theirs too, of like what does it actually feel like? Because I have been like avoiding asking you it.
Yeah.
Because I'm like, I don't know that I want to know too much. I need to just, sometimes it works for me if I build up fear.
Yeah.
And then I'm anxious, and then it's so much less of a big deal than I anticipated.
Yeah.
But I've started to learn that the anxiety has been the worst part for me, and I just want to not. So what would you say, like, what does it feel like?
It feels way less painful, and these aren't even painful, than like a vaccine or like a flu shot or whatever. Like it feels way thinner.
I guess I just, and it is. It's
And
so
it is.
tiny. I guess I just feel weird doing it to myself or having you do it, where I'm like, well, the reason why vaccines don't hurt is because they're doing it all day long. They know exactly how, like little tricks to do stuff, where I'm like, we don't know what we're doing.
It's just, one thing that really calmed me down is if it was hard to do, they wouldn't let every person who has ever done fertility
hard.
stimulations or that painful
I
or
mean,
that anything, they wouldn't let us do it at home. And that has been like so nice.
Yeah.
And every doctor has been like, yeah, you'll get over your fear of needles by the end of this for sure, which I don't have, but like that's
everyone's
their
like,
little
you just
line.
get over it because you have to do it and you do it so much. I mean, even dealing with Riggy, after looking at, I couldn't even look at her sore thing.
Yeah.
And now I'm like, it's fine. I can deal with it.
It really, I can't describe how it feels because it doesn't feel like much.
Yeah.
It's mentally is really the harder part.
Yeah.
It's like the injection is in your tummy and it's like a big like, kind of pen. It kind of looks like an Ozempic pen if you've seen the commercials for Ozempic.
Yeah,
it looks like
that's
that.
That's what I would imagine it to do.
And but it isn't like and then it just like shoots out. Like you have to physically insert it into your stomach.
Yeah, she goes in and then clicks the button on the back.
And that's it. It pushes the medicine in.
Counts to 5.
Yeah.
And then releases. Can you tell once you click, it's a different feeling than the initial push?
It's not different, but that is when my anxiety about it, if any, starts to kick in a little bit. Okay. Because I'm like, come on. Like,
yeah.
And I feel like I'm like pushing it in maybe a little further because I'm like putting pressure on it.
Yeah, it's like.
Which I don't think I am, but it's like.
How much pressure are you have to, like, the first time you did it especially, was it hard to penetrate the skin because you like don't want to?
Just mentally. It has nothing to do with like it being physically hard.
But how did you like get the courage? I know everyone says like, you can literally bite your finger off like a carrot if you wanted to.
Yeah.
But your brain stops you.
Yeah.
I feel like my brain, like, I can poke this shot through a hot dog like it's nothing.
Yeah.
But once that's my body, like, how did you get the courage to like push hard enough? Does that sound crazy? Does that sound stupid?
No, I think with most medical things that I've experienced, and I've done every test in the fucking book. I've done everything you could ever do.
Yeah.
The anticipation is the worst part.
Yeah.
And so it's not like I have so much bravery and I like have the willpower to do it now. It's like I'm so scared of more anticipation
that you're like,
that I'm like, I'm not going to do this to myself anymore.
I just don't know how I could like push something through my skin.
I will do it, but I do think you will do one. I get nervous even like putting
my earrings in sometimes when they've like closed up a little bit, that I'm like, I don't want to push too hard and like hurt something. Like I just get so.
What is also very silly is like I have like a tummy right now more than I feel like I generally have, and it almost doesn't
like,
feel like me. It's weird.
Yeah, that's
I don't know how to describe it.
You're like, I don't associate myself with this tummy.
Yes.
So I'm not giving myself these shots. I'm giving this tummy some shots.
Literally, it's like you're supposed to like pinch your tum.
Yeah.
And so when I'm pinching it, I'm like, what am I pinching right? Like, what even is this? I'm like so surprised that it's there at all that I'm like, okay, I can give this thing a shot.
Yeah.
Even though it's my tummy.
No.
Even though it's my tummy. Oh, we just got someone just joined Patreon. Emma Boyd. Thanks, Emma.
In my head, I was like, oh, they're watching.
They're watching.
They did it because they're watching.
We should do that live one time.
We should do a live one. We'll do it while we're here probably, depending on how we're feeling. Okay, emotionally. So I know with your health anxiety, it was very difficult to distinguish.
Yes.
What are we actually feeling from the injections? Also, she started her injections on her second day of her period.
So you're already fucking cucamonga.
Yeah, you're like, this is not my baseline mood anyways.
Yeah.
But now that you've had a few days to assess everything, what would you say have been the physical feelings, and when did they start, and how have they progressed?
Definitely like period E, but not like... sometimes I get cramps and I'm like, I cannot get up. Yeah. This is more just like ickiness. I feel a little icky in my tummy.
Yeah.
I feel a headache for sure.
Yeah. I read that a lot.
And like my body just feels a little uncomfortable. I just feel uncomfortable. I don't feel in pain other than my headache.
Uncomfortable in what way? Like bloating, or just like a...
Bloated.
Just an overall, can't put your finger on it, but just like a ugh.
Almost like a hangover or something.
I hate that.
Like kind of just like icky.
That's like so rude, as we're not drinking alcohol.
Yeah.
To feel
I just kind of feel icky.
Aww.
Or like before you get sick.
Yeah.
And you're like, I feel like I might be getting sick. I feel weird.
Yeah.
It's that.
But it's like, oh, my throat's not sore.
Yeah.
I'm not nauseous, but something's up in my body.
And then I'm very aware of my ovaries. Like
today I've noticed you're touching a lot more on your stomach.
Yeah.
You weren't doing that the first few days, and today you keep like
holding my baby
it like you're pregnant. You keeping like
it feels like what is happening, which is that my follicles are growing in my body, and like
you can tell something's going down.
Feel it.
Yeah.
Like it's a very weird kind of sensation, which I thought would have freaked me the fuck out. But if anything, I'm just like, oh, this is just like my body doing what it's meant to do.
And it's like you want to feel these so you know that it's working, so you know that like you're fertile and the right things are moving and shaking in our bodies. So.
And I feel just a little brain foggy and exhausted.
Yeah.
So I just feel truly nothing like holy fuck, but everything I've said and read says it just, as you take more medicine, which I will start I think tomorrow, another shot a day or maybe 2 more shots a day, I don't know, it ramps up pretty drastically how you start, how badly you start to feel, I guess, leading up to it. But people work out like this. Like people,
like at this point they have not said, at some point we have to not be doing intense exercises. It's real. I didn't realize why. I was confused. It's so you don't like contort your ovaries,
because your ovaries are getting bigger.
Yes.
And the lining or whatever
the
that
ligament
they're on stays the same size, and so it's like how dogs get bloat.
Yes.
There's like the thing
exactly
in their tummy,
sounds like.
and it can like flip their stomach into like a little circle. But that's not. We talked to someone who said that it was literally, they've seen that, a case of that 5 times in their whole career of 10 years or something.
Yeah, she's done this for decades, and I'd never heard of it. We found this incredible company, not an ad. They sent us their product to try, and I'm just like, I want to invest in this company. I'm obsessed with this company. And
we're like very blown away.
It felt so serendipitous how it happened. So I was sharing stuff about IVF on Instagram, and somebody messaged me being like, hey, you should really check out this company, Dandy. And I checked them out, and I saw their fertility belt. So they basically make the injections a lot smoother. It's hands-free. It's like a belt that you can do an ice pack in it for the shots that need that. There's a heating pad option for when the shots need that, because you do it like 30 minutes leading up to your injections. And then it has like a little thing to like a muscle rub out thing, because some of the injections you kind of have to like move around. It gets really sore. They have these little like tattoo patches so you can know where to aim, because it feels weird. I feel like the first night, even though we knew where to do it, you were like,
oh, it's so anxiety inducing to never know where to put it. I'm like, oh my God.
Yeah, so it's nice that you could be like, let me put on this temporary tattoo and compare it to the chart, and I know. So in the moment when I'm freaking out, I know if I go in this window, I'm good.
Yep.
So they have this incredible product. I was already like, this is great. Love this. Gonna get this.
Yeah.
And then I was on a walk with my friend who is also going through IVF with her partner, and we were like, how the hell does a company not exist that kind of is like a counselor through this or hold your hand through this? Because the doctors, as we've said a million times, just aren't telling you a lot because they can't and they're busy. And we're like, we should start this company. And then we're like laughing and saying how it has to exist. Then I got home and I had a DM from Dandy being like, hey, would love to send you our kit. And I was like, I just created this universe I live in. This was so crazy. And then I got on a call with one of the co-founders, and he explained it all to me, and I was just like blown away. And I learned that they have, right now, they've been in the process of making this company for 2.5 years. They just launched 3 months ago, but they have 2 options so you can do consultations. One is just general IVF knowledge. You can ask them every question. You don't have to feel dumb. We have felt so dumb calling doctors and asking certain things.
Yeah.
Every time I call them, I'm like, this is such a stupid question. I feel like an idiot. You can ask them anything. You can also do consultations on how to give your injections. So if you're nervous, day 1, and we didn't know about this the night of day 1, I wish we did. That was so scary to be like, is this right? Taryn was freaking out because there was bubbles in it, and she was like, oh my God, are the air bubbles gonna kill me? Spoiler, they can't. You're not injecting a vein. You're totally fine. But to be able to do that with, and they're all fertility nurses on the call, would be amazing. So last night we had a call with the other co-founder who's a fertility nurse, and we got off that call and we were like, I was about to cry. I felt so
I was so
relieved.
jazzed up. I was like,
Yeah.
that was my dream situation.
Yeah.
Just to sit
everything.
with a medical professional and be like, I'm just going to say all my stuff at you and you're just going to react and tell me what you honestly think.
You need a doctor on call for that with everything.
Okay, so that's a different story, but I did think about that last night where I was like,
This
after
would be
that call, I was
amazing.
like, that's an amazing company.
Yeah.
It's so legally messy, which is why it probably doesn't exist,
To
because
do
they
like
can't
any
give
medical.
you
Yeah, like
medical
these are
advice
specialists
or-
and they can say like, oh, consult with
Yes.
your doctor. Yeah, that could get messy. And it'd be a lot of health anxiety people.
Yeah.
And then it'd be like, you'd kind of get used to health anxiety people and then you'd be trying to talk them off the ledge and then they'll
Yeah.
like miss something. Yeah, you're right.
But I do think that
shouldn't
it's,
exist.
I think it could. It would just be like a very specific, because Dial-A-Pilot exists, and that's
Yeah.
such a cool
Yeah.
thing where you can like
I mean,
literally call a
most-
pilot before a flight and ask them how it's going to go and say what
Yeah.
you're scared of and all that.
That's really cool. Most medical groups though now have like a call-in line you can do.
Yeah.
So I guess that's that. And you just like shouldn't
But
be calling every day like
it
you'd
was,
want to.
It was just very nice to like be no judgment and knowing that like this isn't my doctor too, so
Yeah.
it's like they're not gonna say it a certain
Yeah.
way or like.
And she'd been through it too. So she's
Yeah.
not just a nurse doing this. She's also been a patient and she's
Right.
been scared.
So we asked her like what to expect from the different medications that I might start. Are we
this-
gonna die from the bubbles?
Yeah. We learned so when we got the package and Taryn was like, they were like 6-inch needles. It was horrifying. She's like, no. You don't use those needles.
Mm-hmm.
That's how they come. Then you like do your little potion mixing to get the right dosage. And then you take it off and they're basically like the needles we've been using.
Which literally changed my entire perspective of this experience, because I was like, every time I give myself a shot, I'm fine, but I'm like working myself up to what
You're
I
like,
thought was the
this is
fucking
gonna-
COVID
this is
needle.
nothing
This like
compared to
big
what we're
ass.
yeah.
Yeah.
Oh, yeah, it looked like a full like vaccine injection. It was
Yes.
huge.
Huge. And now we don't have to do that.
Yeah.
Ideally. I mean, honestly, who knows?
Yeah.
I'm not going to like get so stoked on that yet, but she said that is not the case, and that
Yeah.
made me feel a lot better.
Totally. But Dandy's been so great. They gave me a code for all of you guys if you want to use it to get a discount, because it's really amazing. I was just in my head like, we're spending so much money to do fertility. Of course I will spend another $150-$200
Yeah.
to just have peace of mind. Easy all day.
Yeah.
I'm going to call her once a week. Like,
Yeah.
it's just so nice. So if you guys want to check it out, again, not sponsored. I hope it will be someday. But yeah, it's amazing. We love our kit. It's just, I feel so passionate about this company. Like I truly want to, beyond this being an ad in the future, I want to invest in them. I'm like, how do I get involved with you guys?
Yeah.
Because I'm just, the ease it washed over me after that call.
Yeah,
I'm like,
totally.
oh, amazing. So I will put a link in the show notes if you guys want to check out Dandy and get a little discount.
And it's DANDI.
Oh, thank you.
Not Y.
Dundee. Just Dundee.
Oh, also my boobs have been very extra swollen and hurting.
Yeah.
And I didn't touch on the emotional part yet, but I will finish this with, so far, I've never been more emotional. In those first 2.5 days, I cried constantly.
Yeah.
Like Cam would turn around and I'd be crying over absolutely nothing or over something.
Yeah.
Just
yeah.
like,
Yeah, and it wasn't great that we had a lot going on in those couple days. But then on our dandy call, she called it
Weepy.
Like weepy. Like she's like, yeah, that's what we say. Everyone gets weepy.
yeah.
Sorry if you're watching the video. It is getting so dark outside.
The sun is setting and we are outside and happy.
Oh, it's so cozy. Yeah, I'm like,
So
I'm just
dreamy.
letting it happen.
It's so
You
pretty.
guys enjoy it as the sun sets. It's so lush.
So where we are now is we're going to go do my shot.
Yeah.
Actually, will you go pull it out of the fridge right now?
I would
while
love to,
Say
yeah.
our next steps. We're pulling it out of the fridge, which means we have a 30-minute countdown. Great. And tomorrow is my third monitoring appointment, and I believe that I will be starting a new medicine tomorrow, which I'm not super excited about, but it is what it is. And actually, I will reframe that to say I am excited, because then that means I'm moving it forward, and this is getting closer to like egg retrieval date, which is so exciting. Actually, that is very exciting.
Yeah.
And I'm proud of myself,
You should be. I'm so proud of you.
I'm really
the
proud of
way
me.
you have even handled like the injections, such a boss. But then beyond that and more personal to you, the way you have handled new medication and accepted that like we got to do this and this is like, and you didn't have to do this. I could have just done IUI and carried my eggs, but we want a baby using your eggs that like you were willing to put yourself through this. It means so much to me.
Good.
And it makes me feel really bonded in this. Like,
Same.
I've talked about this before, but there were drawbacks. And I think about a year ago on the podcast, we were really mourning what we couldn't do.
Yeah.
That we couldn't just naturally have a baby together and it be 50-50. I'm so grateful for this experience with you. Like, straight couples, I'm sorry, but like the dad does not know what the mom is going through to create that baby. Mm-hmm. Like, you can be there and emotionally support. But the fact that we get to be like, you had this experience and then I'm going to have the egg retrieval. I'm like, it just makes me feel so much more bonded that we both have to like sacrifice our bodies in some sense to create this kid together. And I don't know. It just feels really special to do these appointments together and be like, you do it, then I do it. And
I love it. I love it. And I'm really excited to help you through it too. I really am.
Ooh,
Cam
that makes one
has
of
been
us.
so amazing. You guys just like caring for me, being sweet. Like when Ricky has
That's
to
nice,
get up
honey.
in the night or whatever, just like you've been really great. I really appreciate it. And just like really patient. And I know that when I'm like crying and then I can't handle the way you said something or I can't, I'm just like so fucking nuts right now that it would be a lot, especially with everything else going on. And I'm just thankful for you.
I love you.
You've been really nice.
If you listen to our top, Frankie, no barking. If you listen to our tops episode, I talked to our like spirit guides that we speak to, and if you don't know what I'm talking about, don't worry about it right now. Basically, a psychic. But the advice that I got was to treat these as two separate things. You're going through something.
Yeah.
Just because I have to do egg retrieval and then carry the kid, so technically in the end I have to do more things. Don't think of it in that sense, which I didn't think I was, but I could see a world where it's like, okay, I'm doing all this for you, but I have to do all of it too, or whatever. Like, I could see how you could like build resentment or just like, I don't know, be aggy and annoyed at sometimes. Separating it and being like, you are going through this right now. I'm not going through it right now. And all I can do right now is be there for you. This like, yes, this is a part of a larger thing that we are both going through, but right now you're doing it.
Yeah.
And all I can do is be the supportive partner right now and not focus on anything that I'm doing in the future. This is about you and helping you through this. Oh my God, we should have had these lights on.
I just remembered.
For so long. We've been sitting here in the pitch black. You guys can't see us.
That's hilarious.
Anyways, shall we go to your vaccine? Wrap it?
Vaccine?
I mean, your... Oh my God, sorry.
Oh my God.
Injection.
Should we go to my vaccine?
You're like, for what?
Please don't vaccinate me right now. I don't need another thing.
No. Shall we do your injection?
Yeah, let's do my injections. And yeah, by the time this goes out, I will have
had your next appointment.
I will have had my next appointment. We will see what's next.
Maybe we'll have an update for the top. So don't forget to join Patreon.
Yep. I was also thinking maybe we strap on meds for this medication moment. Strap on meds?
What are you?
Whoa.
What? The brain fog is hitting us.
Strap on mics for this.
Oh.
For this.
This little session.
Let's
do
what
it.
am I doing? What am I trying to say?
Injection. Vaccine.
For my vaccination.
All right. Let's go do it. Tops. We'll see you over in the kitchen.
Over there.
Over here. We love you guys so much. We'll see you on the pod next week.
Thank you guys for caring too.
Wait, one more thing.
That's it.
We were looking at a timeline of how this works because we also don't know when it's going to happen, and they won't either. It's based on stuff, but there's a world where next Monday you do egg retrieval. So next time we are here,
my eggs might be long fucking gone.
they might be
on
out
their
of
way
you.
to Timbuktu.
That's crazy how much has changed in a week from last week and then to potentially next week.
That actually makes me feel even better because I'm like, that's like not that far away.
Yeah, I'm like, I feel like we record the podcast every day. I'm like, how's a week gone by?
We should record it every day.
No, I'll cry. It's too much work.
Okay, love you guys.
Love you guys. Bye.